Hi, my name's Thomas. I'm one of the second year BSN students with the Nursing Student Mentorship Program. I'm one of the study co-coordinators. And this is Erica. She's another member of the NSNP, third year, and she's the NSNP co-director. Today, the two of us are going to be going over GI, GU, and nutritional assessments. So we'll start with just some subjective questions so I can get a better idea of the patient's history and their current status. And then I'll move in to do an objective assessment. So we'll be looking at the abdomen, doing some inspection and some palpation. Hi, good morning.
Good morning.
My name's Thomas. I'm one of the second year nursing students just down from Camosun College. You're Erica, right?
I am, yeah.
Is that the name you usually prefer to go by?
It is.
And what pronouns do you prefer, Erica?
She, her.
She, her, awesome.
What about yourself?
I go by he, him. Thank you.
Yeah.
So I saw on your chart you're just in here sort of for like a general checkup in regards to sort of like diet and nutrition and sort of abdominal symptoms.
Yeah.
Yeah, sure. If it's all right with you, then we can just start by asking sort of some questions. I'll get a better idea of your sort of health history.
Yeah.
And then we can move into sort of a more specific look at your actual abdomen. We can take a listen and see how everything's doing.
Yeah, sounds good.
Sure. Then I'll start just by asking you some questions just sort of about your diet and your appetite. Have there been any changes to either of those recently?
No, it's been pretty consistent. I eat pescatarian,
Okay.
and I've been eating like that for quite a while.
Okay. And is that usually like sort of a 3-meal-a-day type diet?
Yeah.
Oh, excellent. Okay. And have you noticed any recent changes in weight?
No.
No? Okay, awesome. And how long have you been on the pescatarian diet for?
Probably like 10 years.
Okay, so it's been quite a while.
Yeah.
Okay, awesome. And have you had any issues with any nausea or any food that causes diarrhea, anything like that at all?
No.
No? Any trouble swallowing?
No.
No? And no injuries to your abdomen or to your throat or anything recently?
No.
Awesome, that's what we like to hear. Do you have any allergies to any food or sensitivities?
Not that I know of, no.
None that you know of? Excellent. And are you currently on any medications or taking any recreational drugs at all?
No.
Okay. How about supplements?
I take calcium and vitamin D.
Calcium and vitamin D? Okay,
Yeah.
sounds good. And what is your sort of like activity schedule look like? Like how physically active would you say you normally are?
Yeah, I do cardio like 3 to 4 times a week.
Okay, so that's like sort of like running or cycling?
Yeah, mostly cycling.
Okay, cycling. Excellent.
Yeah.
Yeah, good choice.
Yeah.
And then in terms of alcohol, how much alcohol would you say you usually have, say, in 1 week?
Probably like 3 to 4 glasses.
Okay, 3 to 4 glasses.
Yeah.
Excellent. And then just for finishing off sort of this diet questions, do you have any family history, anyone with like any sort of issues in that area?
No.
No?
No.
Awesome. Then to start with you, I'll just move into a couple other questions more about your sexual health. Is that something you'd be comfortable with?
Yeah.
Awesome. So how is your like menstrual period? Is that fairly regular for you?
Yeah.
And you haven't noticed any changes with that or anything?
No.
No? And it's not usually more or less painful than any other times? It's okay?
No, it's pretty regular.
Okay, awesome. And are you currently sexually active?
Yes.
Yes?
Yeah.
Do you have a history of any STIs?
No.
Excellent. Are you on any oral contraceptives or any contraceptives?
I am, yes.
Okay.
Or I have the Marina IUD.
The IUD?
Yeah.
Okay, awesome. And then have you had any history with pregnancy at all?
No.
No?
No.
Awesome. And then just before I take a listen to your stomach here, you said the diet and everything has been pretty good?
Yeah.
But in terms of output, is the bowel movements and the voiding, that's been okay?
Yeah, really regular.
Okay, and there's no pain or discomfort with that?
No.
Awesome. Then I think that's sort of everything I need to sort of get from you, and then we can move on to take a look at your abdomen. If it's all right with you, Erica, we'll move into like the sort of more objective assessment here. Are you pretty comfortable where you're lying in the bed right now?
Yeah.
Awesome. So I'll just put your side right down here.
Sounds good.
And for the sake of the patient's privacy, I would also draw the curtain, just to make sure that they feel like they're not being exposed in any way. So if it's all right with you, I'll have you roll down the blanket a bit and just roll up your gown. And I just need to take a look at just sort of your stomach right here. Awesome, thank you. And do you mind if I roll your shirt up a bit here?
Yeah.
Awesome, thank you. So you can see the patient's stomach. The first thing you want to do is inspection, so we can see that it's even, the skin tone is even across the abdomen. There doesn't appear to be any bruising or any scars. The umbilicus is midline, and there's no uneven hair distribution or anything like that. And you have no like complaints about anything to do with that? No?
No.
Awesome. So then we'll move into doing the auscultation, so you can pull out your stethoscope. And just for the sake of the patient and infection control, usually it's an okay idea to give the stethoscope a bit of a clean with an alcohol swab, just to follow some best practice. And so I'm just going to be taking a listen to your stomach now, and making sure that like all of your intestines and everything are sort of moving along properly. So we'll be starting sort of in your lower right part of your abdomen and then sort of moving in a clockwise formation.
Okay.
So I'll just roll up your shirt again here a little bit, if that's all right with you.
Mhm.
So you're just exposing as much as the patient is necessary to perform the assessment. And you can start in the lower right quadrant here and take a listen until you hear the bowel sounds. They're usually quite evident unless they're hypoactive or absent. And then you can move to the upper right quadrant. And then across to the upper left. And then finally down at the lower left quadrant. And that's excellent. So the patient has active bowel sounds in all 4 quadrants, which is awesome. If you don't hear bowel sounds in one of the quadrants, best practice is to listen for a full 5 minutes in that quadrant to make sure that the bowel sounds are actually absent. And if you have further questions about that, you can also consult Jarvis or your course pack. Next, we'll move into palpation. So with this, you're just looking for any sort of distension or any pain that the patient might be experiencing. So I'm just going to be pressing lightly on your abdomen, sort of starting in that same sort of clockwise pattern.
Mhm.
And let me know if there's any pain or tenderness anywhere. Does that feel okay so far?
Yeah.
Yeah. And while you're doing this, you can also note things like temperature, like the patient's skin is warm, it's dry, there's no facial grimacing or any sort of nonverbal cues to indicate that they're in any pain. So that all feels good?
Yeah.
Awesome. And then last, you can also move into percussion. This can help give you an idea of if there's any sort of solid spots, or if they're constipated, you can have like a sort of auditory difference when you're percussing over their abdomen. So I'm just going to be tapping my fingers here. It might feel a little strange, but I promise there is a point to it here. Sorry.
That's all good.
And yeah, the percussion all sounds good. So then you let the patient recover themselves so they don't have to remain exposed any longer than necessary. And make sure that they have an appropriate amount of side rails up so they're safe. And then did you have any last minute questions for me?
No.
No? Yeah, it all looked good. Their bowel sounds were active, which means your intestines are sort of working properly. And I didn't notice any issues at all. So it looks like you're doing all great.
Perfect. Thank you.
You're welcome. Is there anything I can grab for you? I'll be back in like 10, 15 minutes to check on you.
No, that's good.
Awesome. Well, it was nice to meet you. So that was our gastrointestinal, genitourinary, and nutritional assessment. We started by asking the patient some subjective questions, so we got a better idea of their health status, and then we moved into the objective assessment of the abdomen. If you have any further questions about how to perform these assessments, please refer to your Jarvis textbook or to your course packs, and they can provide you with additional information. And yeah, thank you for watching. I'm Thomas. This is Erica. Please like and subscribe, and please watch our other videos. Thank you.